Okay, perfect. So I guess if we could start off with you, please introducing both of you, introducing yourselves and your role at your university. I guess first you can go first, and then Leonie afterwards.
You go first.
Yeah, okay. My name is Marissa Moikos-Ravi. I'm a supervising attending at the Department of Anesthesiology, and I have a full professorship for didactics and innovative teaching strategies.
Brilliant.
Yeah, I'm Leonie Kröger. I'm a resident at this university center. I'm in third year now, and I'm part of the research group of Professor Malz. And I've been doing the teaching for one semester full time, and after that I joined the research group.
Brilliant. And where did you, both of you, or maybe one of you heard about it, but where did you first hear about Videolab?
We actually saw it on the AMI conference.
Brilliant. Yes, that was was it 2 years ago, or was it in Basel?
It was in Basel. We met their DAG, and we just talked to him and offered cooperation, and he was interested, and so we said, let's start it. And we gave him 2 projects which we wanted to investigate. And we wanted to expand the use of Codific of the Videolab, like looking beyond just the communicative strategies which have been investigated. And we wanted to put the focus and target non-technical skills during emergency situations, and also the patient communication during pain visits.
Brilliant. So I was just going to start by saying, can you explain a little bit possibly about your scenario prior to using Videolab, and why you liked the interest and why it interested you to test it, basically?
Yeah, sure. Leonie, you want to?
Yes, so in my experience, after I've done all the teaching a lot and the resuscitation scenarios with the students, and I've been giving a lot of feedback, and I always gave them a little examples what they've been doing in the scenarios. And I was like, for example, when someone said they needed an intubation tray, you were like very busy at the feet of the patient for whatever reasons. You're doing the craniocollar check or whatever, and the students did not really see that. They could not have like a holistic picture of how the scenario went and where they were in specific situations. So I think that's why we like got in contact with DAG at the AMI, because I think that if they have a video-based feedback and actually can see themselves what they've been doing, they reflect more on it and have like a better situational awareness.
Yeah, and what Leonie says is pretty much important, because what we also have in simulation-based medical education is the classical videotaping and then the debriefing based on the videotaping. And what we know based on learning psychology is that debriefing is one of the strongest factors for team building, resulting in enhanced non-technical skills. Okay, so videos are available, but the reflection, this is the most important thing which Leonie has pointed at, and Videolab from Codific enables us to do a really point-to-point feedback or short feedback, and this enhances the reflection, and then this equals accelerating the learning process. Or better to say, what they can add too is, you know, knowing something is one thing. I know the algorithm of resuscitation, right? But translating that into my behavior during a stressful situation, this is actually what is really hard to teach and to be trained. And I think this point-to-point feedback, which Videolab gives us the possibility, this is really, really pushing that.
Brilliant. You mentioned that you use it obviously for communication skills, but it's not only the only use case that you have with Videolab in your university. What other departments or what other programs do you use Videolab in?
So first of all, we use it in 2 studies right now. The first study is like talking to a patient who is suffering chronic pain. Patients with chronic pain, you need to be very empathetic, you need to be very understanding, and we are trying to compare the classic peer feedback with Codific Videolab. But what we do, and this is looking beyond, like Leonie has said, if you train resuscitation, right, cardiac arrest, you have to do it simulation based, because you cannot take the students to patients who are unconscious, because this is not possible, right? So you need somehow a secure environment. You can imagine we have a simulation center, you have different rooms. In each room, there's a high fidelity simulator acting like a patient. They have vitals you can measure, they have a pulse you can see, you can ventilate them, intubate them, and like mimic everything you can do on a normal patient, okay?
Wow.
So we put students into that scenario and tell them, for example, imagine you've been called to an emergency in the mall, and you just get there. And these 3 students, one is the leader, like the physician, because in Germany we have physicians who are on the street, and the other 2 are the paramedics. These are like playing the scenario. And while they're playing the scenario, they need to have technical skills like checking for consciousness, like ventilating. This is easy to convey. But they need to talk to each other, not only communicating, but team leading, team orientation. Like someone is too not fast enough in resuscitating. He's tired. The leader needs to see that. And these are the factors hampering a good resuscitation scenario. And with Codific, we can like really show them what has happened and how they can change their behavior. So we can enhance their reflection on the surrounding skills of resuscitation during a simulation-based emergency scenario.
Okay, awesome. And do you typically, going a little bit more to technical point is, can you tell me a little bit about the implementation of Videolab within your like faculty, within your university? Did you find the process? How did you solve some issues within the implementation, or what was the whole process that you took?
First of all, we bought some iPads to record the things, and with some, I don't know how to call them, wie heißen diese Stative?
Like tripods.
Yeah, so you have them there, so they're not,
Yeah.
And then Leonie, you can correct me if I'm wrong. We have someone who does his thesis on this theme, so he was responsible for all the students to get registered, because you need the QR code and everything. I mean, it's secure, but it's not like just a link which they can like click on and everything is working. But it worked out, Leonie. I don't have other feedback. It worked out with all the students.
Yeah, it worked out. I mean, I think whenever you implement a new technique, it's always challenging in the beginning. And but as Parisa said, there was someone doing his thesis on it, and he designed like perfectly flowcharts on how to register and how to log in and how to use the platform. And so yeah, I think in the beginning it took more effort to have, like Parisa also said, we had the simulations in 3 rooms at the same time, and also with the educators were not really good with the platform. Someone needed to go into the rooms and help them out. So I think in the beginning that was a little bit challenging, but it took a week or 2 and everyone knew how to use it and how to log on. And so yeah.
Brilliant. And have you had any feedback from the students? How have they felt towards Videolab? Do they feel like it's helping them? To what degree? What's been their sort of, obviously, as you've said, it can be challenging, especially like the first few, as you've said, 2 weeks of implementation, getting the students used to it. I think getting the students used to being recorded as well. I think a lot of that could be maybe a little bit difficult. Obviously, students could feel under a lot of pressure having kind of a camera looked at them the whole time, but then obviously there has so many other benefits with feedback. So how have you felt students have reacted to the implementation of Videolab? What have their thoughts? What have their feedback been?
Well, they're used to being recorded by us, because we do a lot of studies and we need the videos for a lot of endpoints. So that was not a problem. But well, the feedback was they liked it somehow, but they also said, well, can we not, instead of, because after the first video, they sat together and watched the video together. That was a little bit awkward for them. But we thought this is the way they should process together the scenario, because they were involved in that scenario together, right? So they found it a little bit awkward, and they were like, yeah, but don't we have more benefit if we do one simulation scenario more? And we know, because we've investigated, that it's not the case. So therefore, they were doing it and they were happy about it with this feedback, which I told you. But in general, they used it a lot at home too. It was not that they didn't use it at home.
Okay.
Yes, they used it. And we forced our medical educators, or not forced, we asked them to do the feedback. So first they watched it together and then they got the feedback with a delay from 1 hour or something.
And also from experience, I think students always feel a little bit self-conscious, even just going into a simulation, because it's also like a new scenario. It's something that they have not done before very often. So I think our medical educators, they're very sensitive about like creating a safe environment and telling them it's not about like putting you on a platform and like want to judge you. We want to actually that you learn from what you've seen. And what I've also heard, like that they were really happy that they could look at it at home again. And yeah.
Awesome. What aspect of the tool, of the Videolab tool, are you most pleased with, or that has impressed you the most in terms of results, or just in terms of like the use of the tool in general within your curriculum?
Well, I think the timeline where you can either make thumbs up, thumbs down, like on TikTok. This is really good. So you have the short feedback, and then you can specifically comment on the second, and the students see exactly the second, because normal video-based feedback is like you sit there and you say, yeah, see here, you didn't do it like this, but you can exactly comment something which they can see at home. The exact timeline of the comments, I think. Leonie, what did you think? I think you've used it too.
Yeah, I think that's also a good point. And also that, I mean, there's one medical educator watching 3 people, so they can't have eyes on everything every time. And I think it's a good thing that when the students reflect on themselves, they ask specific questions. Hey, here I did that, or asked that, was that right? And it's very personalized also, the feedback.
Brilliant.
And I thought that's right.
Brilliant. And logistically, as you mentioned, do you find it has helped save time for yourself and for the other teachers, as they don't have to be in three places at once?
No, there's still it's still that way, that in each simulation scenario, which takes place simultaneously in different rooms, there is one instructor, one medical educator. Actually, for the simulation scenarios of emergency medicine, it's even more time consuming than for normal, I think, patient communication, where you don't need to be in and supervise it. But I think the benefit is still much greater. We will do the interim results and we can share them with you. But I think the results will be much greater than just doing a normal feedback or peer-to-peer feedback.
Brilliant. And on that line, what are your desired or your results and expectations from introducing Videolab into the learning process?
I just supervise all the education. I never do the education unless the lectures, but based on the experience and my knowledge from learning psychology, it has to have an effect. And we've conducted one study with flipped learning. I mean, Codific Videolab is kind of flipped learning too, if you want it that way. And we could show that the flipped learning, due to its reflection, enhanced the non-technical skills. And if that did it, then the Videolab should do it too. But I'm looking forward to the interim analysis.
Brilliant. Okay, well, I only have a couple of last questions, and I think it would just be, how do you see the future of healthcare, and where or what role video recording has within the industry?
Well, I can start, Leonie, then you can add. I think it will have a very, very, very big role. I think you have to see it from 2 angles. On the one side, in medical education, we are since 10, 20 years starting to be innovative, starting to restructure the curricula. The medical educator was traditionally always the doctor. You know what I mean? They were not as trained as they are today. And this innovative strategies, not only Videolab, also VR and other stuff, will be important aspects to redesign our curricula. And Videolab will have a great impact on even healthcare, because you have a really, really big reduction of supervising time when you have the Videolab, where just a resident goes and says, I'm going to do whatever, talk to a patient, and can you just give me feedback afterwards? And that will save a lot of time, and that will restructure and redesign even postgraduate education.
Brilliant.
Yeah, that's what I also wanted to say. That's also what we talked about, that we would also like to try to do that with postgraduate medical education. So there is going to be feedback from attendings or supervisors for residents, but also you could use it like the same situation we have now for medical undergraduates, where we talk to a patient about chronic pain. You could actually use it in day-to-day practice. So the patient has actually the video, can log on to Codific and ask questions and reflect again, because there's a lot of times there's a lot of input, medical input, that they don't understand maybe right away. They don't think about their questions right away, and then they can go home and watch the video again, have the talk again, right? And then also ask questions again to follow up on what they didn't understand. So I think that should also be a part of that.
Brilliant. And just to confirm, at the moment you're using it for undergraduate medicine, correct?
Yes. Yes.
Okay, and with the courses, it's a various of courses, as you mentioned, emergency communication.
3 vast emergency courses, including over 180 students right now, and 1 big pain seminar where we've integrated that.
Brilliant. And how, if it's not too complicated to explain, how are you, obviously I know that you're doing multiple research on the effectiveness of Videolab, or on the effectiveness of direct feedback after a session, compared to obviously Videolab with the self-reflection and the video feedback. How are you measuring the results? Is it purely from students' feedback on how they feel like they've improved their skills, or is it a more complicated data process?
You don't want to say? You're an expert right now. I made her an expert.
Well, there are validated tools and scores that you could use. For example, so one of them is the comparative self-assessment. It's validated. It's from Professor Raupach. He was in Göttingen. It's a variable of just items where they the students write, I feel comfortable like doing ACL algorithm, and then there you have a scale, and we measure it before and after. Also, we always look at the motivation. It's also a validated scoring system where the students answer their questions. Also, we do that pre and post. And also, Parisa validated a score about the non-technical skills, which we measure during the simulations, and it's all the medical educators have like a score, and then they rate the students and how they do it. And we did the same with also a quality of CPR skills. We also have the validated tool for that. So that's what we use. So we have the on the one hand, we have the self reflection of the students, but also objective tools to rate the resuscitation skills and the non-technical skills. And also,
sorry.
Yeah. No, it's okay. Do you want to add something?
No. Obviously, you've mentioned that you use Videolab very much in you giving feedback to the students and the students being able to self-reflect. And also, you mentioned that you do show the recording like in a classroom sort of wide setting where they can get feedback from their peers. Is that like a formal sort of feedback process, or do you just typically do it after the session, or do you allow peers to actually also have access to recordings and give their formal feedback through Videolab?
Yes, they have 3 different teaching or training units. The first unit starts with a resuscitation scenario, which is directly recorded by Videolab, and which is then shown to the students at play. and they should have a reflective talk about the scenario. But also on that video, the students are allowed or asked to do the feedback, and the instructor is doing the feedback as well during the time. And every scenario is videotaped, and every scenario is rated like that.
Okay.
But we only share it with the students who are actually part of the
Yes.
scenario. So we don't share it with the whole semester, because that would be something I think that the students would be feeling self-conscious about and not really comfortable with. So only
Yes.
with that they within their small group.
Okay, very understandable. Okay, thank you so much for your time.